Namaste viewers, welcome to the Facebook live session. As we celebrate today World Asthma Day, today our topic for discussion is asthma, its causes and treatment. And for our discussion, we have with us Dr. Chandrakant Tarke, Senior Consultant, Interventional Pulmonologist and Sleep Disorder Specialist at Apollo Hospitals, Hyderabad. Dr. Chandrakant Tarke is a top pulmonologist in Hyderabad at Apollo Health City, Jubilee. He holds an experience of 12 years in medical field. He is previously affiliated to BP Chest Institute, Delhi, Apollo Hospital, Delhi, and Rajan Babu Institute for Pulmonary Medicine and Tuberculosis, Delhi. He has received many awards including Professor S.N. Gore Young Scientist Award 2016, Dr. APJ Abdul Kalam Memorial Excellence Award 2021 and Vaidya Ratna Award 2022. He has multiple publications in national and international journals and written chapters in books. He has delivered talks, lectures in various scientific conferences and meetings. Welcome, Doctor, to our Facebook live session.
Thank you.
So, starting with our questions. So, Doctor, could you please tell our audience what is asthma and what are the causes of asthma?
Asthma is a disorder of airways. In lungs we have the two things. One is airways and second thing is a parenchyma. Airways, air just travels through that airways, and in the parenchyma the oxygenation and carbon dioxide removal part takes part. The air should reach the airways, but in the asthma there will be the inflammation in the airways. Airways will get swollen, and because of this excessive phlegm will form over there and it narrows down. And because of narrowing of the airways, there will be resistance to the inflow of the air. The air will go with much difficulty into the airways, and which causes wheezing, breathing difficulty, cough, chest tightness. This is the asthma. Causes of asthma are exactly not known, but there are certain factors which can causes the asthma or which can trigger the asthma. Asthma can be a congenital thing. If the father is having asthma, a child can have asthma. Some factors such as environmental allergen exposure, some smoke exposure, air pollution, these are the factors which can trigger the asthma in predisposed individuals.
So, Doctor, does childhood asthma goes away with age?
Some children, around 50% of the children, their symptoms vanishes when they grows, but it's not true that they grow out of asthma. Means children when they grow in adulthood, sometimes their symptoms can return back. Some children, their symptoms will vanishes over a period of time, but some symptoms may present. That's why it's wrong to say that children go out of asthma, but we have seen almost 50% of the children, their symptoms reduces significantly when they grow.
So, is it true that people with asthma should not exercise?
It's not true. Basically, exercise is important need for every human being. Similarly, asthmatic patients also, to improve their lung capacity, to improve their lung function, exercise is important. But only thing that during the asthma attack, they should not exercise. But when they use the inhaler, when they are using the medicines properly, when their asthma is controlled, they should exercise, they should go to gym, they should do everything. Even many Olympics gold medals, almost 10% of the people, even many sports people, they are having asthma. But their asthma is controlled, that's why they can do everything.
So many people believe that medications used for asthma are habit forming and become ineffective over time. What are your views on this?
The asthma medications which are used in asthma are not habit forming, and they will not be effective over the period of time if you use them regularly as per the doctor's advice. Asthma medications basically are used for the two reasons: to reduce the inflammation in the airways and to expand the airways which are narrowed down. That reduces the asthma symptom, that reduces the breathing difficulty, wheezing, chest tightness, and it's basically need of the body. It's not the habit. As there is inflammation in the airways, we need to control this inflammation to prevent the future damage in the airways. That's why these medicines are not habit forming. Basically, this is a requirement in the asthmatic patient, and this will not have any major significant side effects.
So, doctor, is it true that asthma should only be treated when symptoms arise?
It's not true. Basically, asthma is the inflammation of the airways. The inflammation on exposure to the allergens can occur at any time. Sometimes inflammation goes on, but patient may not have any symptoms. That's why to prevent the inflammation, the person or the patient should use the inhalers regularly as per the doctor's advice. But there are some instances, some patients will have only seasonal asthma. So during that particular season, they need to use the inhalers, and during the season where they are absolutely symptomatically free, symptom free, they can reduce the dose of the inhaler as per the doctor's advice.
So does everyone with asthma experiences the same symptoms?
Asthma symptoms basically are the cough, breathing difficulty, wheezing, chest tightness. These are the basic symptoms of asthma. But some patient, they have the different symptoms. Some patient can have only cough, that is called as cough variant asthma. Some patient can have only wheezing sound. That's why it's not true that all the symptoms should present in one patient. Some patient can have only during exercise, that is called as exercise induced asthma. That's why all these symptoms may not be present. Patient can have variety of symptoms among all these explained symptoms.
So doctor, is it true that every asthma patient should avoid cold food like milk, curd, etc.?
It is well known that the dust exposure, cold exposure can aggravate the asthma symptoms. Cold atom means the atoms which are related to ice, such as ice cream, cold drinks, which are actually cold, means temperature is less. It's not like that some banana, orange, which traditionally thought to be cold, we should not consume like that. It's not like that. That's why patient should not blindly stop all these atoms. Particularly, it's seen that many mothers don't give their child, if they are having asthma, they don't give the fruits, they don't give oranges, banana, lemon and many things. Basically, child needs multiple fruits and vitamins for their normal growth. But because of fear of asthma, they start stopping all these fruits and everything. That's why blindly we should not stop all these fruits. Only thing, for example, it's easy way to identify the allergy. For example, if you are giving curd to your child, if child is developing symptom every time if he consumes the curd, then you can stop using that atom. It's easy way to identify the allergy. It's not that one time if your child has consumed some atom and he develops some cough and you should stop that food atoms for entire lifespan. It's not like that. That's why you need to identify the allergy and you need to stop that particular food atom. Routinely, blindly, we should not stop all the food atoms. But main thing that we should avoid in asthma is the cold exposure and the cold atoms such as ice cream, cold drinks. These are the main atoms to avoid.
Okay. So does the steroids used in asthma are dangerous and these steroids will stunt growth?
Steroids are used in asthma. They are the drug of choice for the treatment of asthma. People will fear by the name of the steroids, but you should understand these steroids are different than the anabolic steroids which are used by the athletes. The steroids which are used in asthma, they are in the microgram. If you read on the inhaler doses, they are the 200 microgram, 100 microgram, 400 microgram. And the tablets that we consume, they are in the milligram. Means doses of the steroids are the 1000 times less than in the inhalers. Basically, inhalers are the advances in the medical field. Instead of consuming, for example, if you are having itching over the skin, we'll apply the skin ointment. If you have the itching in the eyes or redness in the eyes, we use the eye drop. Similarly, there is a problem in the airways in the asthma, so we should use the gaseous, this inhalers, gas or the powder inside the airways that acts locally. If you consume the tablets, that goes entire into the body, in all the organs, but in asthma, the majority, the lungs are involved. The inhalers will give the medicines to the lungs only, and that are very low doses, and that will not cause any significant side effects. And even in the children, some people think their growth will get stunted, they will not grow fully if they use the inhaler. It's totally wrong. If the asthma is not controlled, if the child is sick, their growth may stunted. That's why if you use the inhalers, steroid inhalers, whatever the inhalers prescribed by the doctor, their asthma will remain under control and they will grow normally. That's why person should not think that the inhaler have the major side effects. It's nothing like that. They should use the inhalers.
So many believed that inhalers are addictive, unsafe, and cause many side effects. Is it true?
Just now I have explained the inhalers are advances in the medical field, and the doses are there in the microgram. The absorption from the lungs into the blood is very minute, and the side effects are not significant. It's a very minute side effects, and majority of the patient the side effects will not happen. Only thing with the inhaler, the person should gargle the mouth after using the inhaler. Otherwise, it can cause some redness over the tongue or in the mouth. That is the only major side effect, but that also can be avoided after using inhaler. Person should rinse the mouth with water. That's why there is no major side effect of the inhalers, and it has many benefits, and asthma can remain under control with the use of the inhalers.
So coming towards our next question, doctor, I have heard people saying asthmatic children should not play sports or be active. What are your views on this statement?
They should do everything. For child's growth, the physical exercise, sports is an important aspect. And if your asthma is under control, so we can do everything. I told you just now also, there are many celebrities or sports persons who won many medals in Olympics also. They have asthma, but their asthma is controlled with the medications, with the inhalers. They can do everything. That's why there is no contraindication for the exercise. They can use the inhalers and they can exercise.
So coming towards our audience questions. So doctor, why do we celebrate World Asthma Day?
World Asthma Day is celebrated every year on 3rd May, and this day is celebrated to spread the awareness of the asthma, to educate the people with the asthma, to teach them how to use the inhalers, how inhalers are safe, and how asthma person can lead normal life. This is the motive behind to celebrate the World Asthma Day. This World Asthma Day, we have the theme to fill the gaps in the asthma care. That means some people in the peripheries, in the villages, in the small towns, they don't have much access to the specialist. They should get the access to the specialist. They should get access to the pulmonologist in the cities, and they should learn what is asthma, what are the advances in the treatment, and with that how the asthma can be controlled. And all these myths regarding asthma, all these myths should go, and they should know the truth regarding the asthma disease and its treatment. That is the motive behind the celebration of the World Asthma Day.
Okay, doctor. So what are the complications of asthma if not treated?
Asthma, if not treated, it can cause problems like, for example, as I told initially, the asthma is the inflammation of the airways. Over the period of time, if the person is not taking inhaler regularly as per the advice of the doctor, and the patient is following some different treatment, their airways get inflamed, and slowly that airways can become permanently narrowed. That is called as remodeled asthma, and they can have the breathing difficulty later on, especially on the walking, climbing stairs, and their asthma can become persistent. That is the one problem with the non-adherence to the treatment. Second problem, they can have the fatal asthma, or it is called as acute asthma. If they don't use the inhaler regularly, if they don't follow the doctor's advice, they can get the acute asthma attack, and which can be life-threatening.
So doctor, what causes asthma in adults?
Usually asthma is a childhood disease. Usually it starts in the childhood. That is called as atopic asthma or extrinsic asthma. But asthma sometimes can start in the adulthood. That is called as intrinsic asthma. And the risk factors for this asthma are the smoking or air pollution. We see many adults, they do smoke. Tobacco smoke exposure along with the nicotine, it has thousands of many chemicals which can cause the damage to the airways, inflammation in the airways. Similarly, air pollution, not only outdoor air pollution such as vehicles or industries, but also indoor air pollution. Indoor air pollution in the form of, especially in the villages, the ladies who cook food over the chulhas, they burn the cow dung and the woods to heat the water or to cook the food. The smoke which is coming out of these devices will cause a damage to the airways. Also, some people they do the puja with the agarbattis and all these things. That also produces a lot of smoke, and scientific research showed that smoke which is emission, smoke which is coming out of the all these dhupbattis, agarbattis are also equal to the tobacco smoke or cigarette smoke, and which is equally harmful. So this is the reason why the adults also develop the asthma. Even if their childhood is normal, if they don't have the asthma in the childhood, but in adulthood they can develop the asthma because of all these reasons.
So how can we prevent asthma?
As I said, asthma is not a totally preventable disease, but especially the asthma which can develop in the adulthood, in the elderly, with the known some factors such as the smoking and exposure to the air pollutants, indoor air pollution. All these factors are, we can avoid it, we can stop exposure to these factors, and additional factors which helps to prevent the asthma, which helps to control the asthma. Certain diet habits such as we should avoid the excessive cold exposure, cold items, especially those patients who are prone for allergy, those who are having allergic cold, allergic rhinitis. These people can develop asthma in future, especially if they smoke, if they are exposed to the air pollution. And also the asthma people, or in general, people should do the respiratory exercises such as yoga, pranayam, routine health exercises, and checkups also. With that, we can prevent the asthma exacerbation, we can prevent the development of asthma, we can control our asthma.
So doctor, does asthma show up in blood tests?
Asthma is a diagnosis by the clinician. Asthma is usually diagnosed based on the symptoms. As I told, cardinal symptoms of the asthma are the wheezing, chest tightness, breathing difficulty, cough, and the diagnosis by the physician or pulmonologist by auscultation with the stethoscope. They will have the musical sound from the chest because of the narrowing of the airways. But there are some certain tests, especially pulmonary function test, some blood test. During the attack, we can have some idea regarding the asthma, but we can't diagnose the test based on this blood test or PFTs. The blood test like IgE, immunoglobulin E, is helpful to diagnose the allergy, and is the one way we can diagnose the allergic asthma.
So what are the treatments available for asthma?
For asthma, basically two treatments are available. One is a controlled therapy, and second is a reliever therapy. In controller medications, we have the inhaled corticosteroids. As I told, inhaled corticosteroids are safe. The doses are very less than the tablets, and these reduces the inflammation in the airways, and asthma will remain under control if we are using the inhaled corticosteroids. The second variety of the medicines are the inhaled bronchodilators. They can be short acting or long acting. Basically, these are used for the long control of asthma, especially long acting beta 2 agonist, and second one is a short acting beta 2 agonist, a short acting bronchodilators. These are used during the attacks of asthma, especially they are used in the form of nebulization, and asthma can be controlled with these medications. There are some additional medications. If the patient's symptoms are not controlled on inhalers, the second steps comes in the form of tablets. We are having the anti-allergic medications such as cetirizine, levocetirizine, montelukast, fexofenadine. These are the anti-allergic medications which are additionally used to control the asthma. The additional medications are the oral bronchodilators. This is a third line of treatment. In this, we have the deriphylline, doxophylline. These are the medications which we use on a consultation after consultation of the treating pulmonologist. And there are certain medications such as nebulizations. Nebulizers are the machines in which we need to put some liquid, and with that medication will be turned into the vapor kind of thing, and that the person has to inhale. Basically, these medications, nebulizers, are used in the children, in the elderly and sick patients to control the asthma symptoms.
So doctor, what triggers asthma attacks at night?
Asthma, basically most of the cases is an allergic disease. In the night time, usually will be in the bed most of the times, and some houses or some beds or carpets, they have the house dust mites. These are the very small insects we can't see with the eyes, and when they die, their substances that is called as house dust mite, allergens, some cockroaches, mosquitoes, when they die, their dust will be there in the floors, in the beds. So because of that dust and everything, when we cover over our face, then also from through the blankets, we can inhale these allergens and we can have the increase in the asthma symptoms. That is the most important trigger for the asthma during the night time. But also some patients, they can have the sinusitis, post nasal drip. We can have the coming secretions come out from the nose into the throat, and also some patient can have the acid reflux during the lying down position in the night. That's why most of the patient, their symptoms aggravates during the night time in the asthma.
So is steam good for asthma?
It's there is no scientific evidence that steam is good for asthma, but definitely if the patient is having associated nose allergy, nasal blockage, sinusitis problem, steam can give the symptomatic relief in those patients. But as such, there is no scientific evidence that steam gives relief in the asthmatic patients.
Can asthma be life-threatening?
Yes, asthma can be life-threatening in rare cases, especially those people, those who are not under treatment of asthma, those who are not using their inhalers regularly, and those patients who are suddenly exposed to some allergens, they can have the increase in the asthma symptoms. And if it is not getting detected or treated at the right point of time, they can have the excessive airway narrowing. The air will not go into the lungs, and that is called as fatal asthma attack, and they can have the life-threatening asthma at that point of time. That's why treatment of asthma is most important, and person should use the inhalers as per the doctor's advice, and they should not stop the using inhalers and believing in the all these myths, inhalers are dangerous, inhalers are having side effects. They should not believe all these myths.
So coming towards our last question, doctor, please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills.
Apollo Hospital Jubilee Hills, we are having a team of good pulmonologists, and we are having center of excellence to treat the asthma, allergy and allied sciences. We are having state of art pulmonary function test laboratory. We are having the complete lung function test, diffusion lung capacity, forced exhalation nitric oxide test, and variety of other pulmonary function tests in our laboratory. We are having the different allergy tests also, including food allergen allergy test, inhaled allergy test, and immunoglobulin E. These are the various allergy tests which are available in our hospital, and we are having specialized care for the asthma people, and we are having all the advances, all the medications which are newer therapies. Especially there are some newer therapies like monoclonal antibodies which have been recently released into the world, means invented recently. These therapies are also available at Apollo Hospital Jubilee Hills, Hyderabad. So people can take benefit of all these therapies here.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Chandrakant Tarke and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Thank you.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.